The way we treat skin cancers depends on one, which type of skin cancer it is. Two is how far it is and the subtypes that we have. And three is the area involved as well. So in certain areas we want to go more conservative approach. We want aesthetically to look better. So face, eyelids, nose, those areas we sometimes try and be more conservative. End of the day, any cancer needs to be cut out. And that is the first thing we need to know. There are newer treatments called photodynamic treatment. There's chemotherapy creams, which if a cancer is very early, you tend to get away without having to cut out. But the simple answer is, if you have a skin cancer, you cut it out. If it's a BCC, a basal cell skin cancer, they're generally slower growing, so we can do a simple excision. Squamous cell skin cancers, you tend to cut a bit bigger, and a melanoma, you need to cut it out with a 2 centimeters border around every area. And that will decrease our risk of recurrence as well. We generally want to cut quite deep because we want to get everything out, and when the pathologist is staging these lesions, he wants to give us a nice staging to say, you know, we've cut it out completely and everything is gone. But again, the key depends on how early you pick it up. If it's early, it's a small excision. If it's late, it can be large excisions, can be amputations as well. We sometimes look at radiation and chemotherapy. In skin cancers, it's not as commonly used. Radiation will be used in areas that are difficult to reach, difficult to excise, difficult to do surgery on. So often we choose to do radiotherapy in eyelid areas, some areas of the face which are difficult to get the skin together, but also in patients where they are older and they can't handle going to the theatre, can't handle a general anesthetic, can't handle a surgical option, we then go for radiotherapy. And radiotherapy is generally a good option. It needs few treatments, but it's generally a good option. Chemotherapy is not often used in skin cancers, but in melanoma, certain types of melanoma, there are newer treatments available to slow down the spread. But radiotherapy is one of the options we use, apart from doing the surgery. We want people to not be afraid of getting the diagnosis, first of all. The longer they wait, the bigger the procedure will be. And in general, in most cases, it's a simple procedure with a bit of local anesthetic done in our rooms, with a little bit of a sting from an anesthetic for 5 or 10 seconds, and then they don't feel anything. So generally, we catch them early. It's a small procedure. We want people just to understand, it's most cases, it's not a big procedure. There's not a lot of downtime. In most cases, we have patients come in, have their skin cancer treated, and walking out and going on with the rest of their life. But key is early detection, and early detection.